The vision of the Oxford Academic Health Science Network is to achieve best health for our population and prosperity for our region. We seek to do that through supporting collaborative working between our NHS, university and life science partners in the area, and we also strive to support the development of a strong life science cluster in the Oxford AHSN area. One of the key ways we're looking to improve our patients' health and outcomes is through 10 clinical networks that work across clinicians and structures in the Oxford AHSN area to improve care in particular disease areas. These are at an early stage, but we're already seeing these add real benefit in spreading best practice and improving patient experience and quality of care. The out-of-hospital network we developed looks at how we can develop alternatives for the better management of frail older people who are acutely unwell by providing care in community hospitals closer to home rather than having to travel significant distance to a local accident and emergency department. The Abingdon Emergency Multidisciplinary Unit has already won an award for the work it is doing in this area. Patient safety is a key priority for our NHS partners. Our surgeons have developed a collaborative programme to improve the investigation and management of patients with suspected appendicitis, a common problem in clinical practice. Looking forward, our partners have identified 4 key areas of patient safety where they will work. These are medication safety, mental health, acute kidney injury and pressure ulcers. Our HSN team is supporting the more rapid uptake of innovations that have been shown to provide clear benefit to patients. We're doing this through identifying each year 10 innovations that can be taken up across our NHS partners. Examples in our first year's programme are the better uptake and more rapid uptake of drugs recommended by NICE. So we have programmes looking at renal cancer drugs and the new oral anticoagulants which provide an alternative to warfarin for patients with atrial fibrillation. Another way the innovation adoption team is working to support uptake of innovation is working with the clinical networks and the other research structures. So an example of this is the system developed by the Oxford Biomedical Research Centre to improve the management of diabetes in women who are pregnant and develop diabetes with a telehealth system which provides better monitoring and control of blood glucose for women who develop diabetes during pregnancy, and this uses monitoring at home with connection to the internet and specialist advice, avoiding the need for regular weekly visits to the antenatal clinic. Our work to promote prosperity for the region and support the life science companies in our area is very much in partnership with the local enterprise partnerships in Buckinghamshire, Berkshire and Oxfordshire, bringing the experience and expertise of the NHS to companies in our area to help them develop innovative products relevant to the NHS and do that in a rapid way. Another area we've worked at to improve the development of innovation is we produced a roadmap for innovators who are developing medical apps to improve patient care, and that has now evolved into supporting the development of an e-health laboratory where new digital health technologies can be developed, bringing together researchers, clinicians and experts in digital health. In supporting research and development in our NHS partners, we're working to strengthen partnerships between our universities and the NHS. We have some interesting developments already, so Buckinghamshire Healthcare Trust and the Buckinghamshire New University have developed an academic programme and post in emergency medicine, and Buckinghamshire New University has developed an Institute for Integrated Care. We have a new medical school opening with Buckingham University, which will be supported by the Milton Keynes Trust. Looking to the future, we are looking at how we support the plans outlined in the 5-year forward view for the NHS. We see we have a particular opportunity and role to break down the barriers between general practices and hospitals, between physical and mental health, and between health and social care through our network structures. Another priority for us moving forward is to draw upon the strengths of our universities and life science companies in our area, and developing partnerships with the NHS to ensure we draw upon innovation more rapidly that we can bring to benefit patients.